To everybody.
Go
I
ahead.
am Dr. Meghana, Clinical Head and Fertility Specialist at HSR of Layout, Oasis Bangalore. Today, I am going to be talking about the effect of stress on the fertility potential of the couple. When I am talking about stress, it's not only the physical stress I am talking about, but I will be talking about the stress the couple goes through emotionally, morally, probably financially also, but that is something for another day. So, physical stress and mental stress are the two main things which can have a positive effect or a negative effect on the outcome of the cycle. So let's talk about the physical stress on the infertility. Before that, let us also discuss whether the stress really causes infertility. Yes, to a certain extent, physical stress in very heavy, stressful physical activity can have an effect on the fertility potential because if at all a person is physically very active, it can have an effect on some of the hormones being produced, the secretion of the hormones, the balance in the secretion of the hormones is affected because of which the cycles might get irregular, the ovulation might not happen, and thereby affecting her chances of achieving a pregnancy. So, when we talk about physical stress, what kind of physical stress are we talking about, and whom are we targeting here? So, when we are talking about increased physical stress, the first thing which comes to our mind is athletes. Many of the athletes who are into a vigorous kind of physical activity, they find that their cycles might become irregular. This is because there is a fine balance in the production of the hormones, what we call as the hypothalamic pituitary ovarian axis. So this can get affected because of the increased stress or increased physical activity, thereby her hormone secretion being affected, or it can lead to a change in the secretion of hormones like the gonadotropin releasing hormone or the prolactin levels, thereby affecting the production of estrogen and progesterone. When these hormone productions are being affected, the woman can have irregular cycles or might have a prolonged amenorrhea, that means not having periods. And in that case, the ovulation doesn't happen, and she might not have a pregnancy because there is no ovulation. Then we are also coming to other factors where they can have only a very limited period of time physical stress, like they are going through a very heavy physical stress where they are planning to reduce weight, or they are going to have a physical stress to improve their physical endurance if somebody is planning for a trip. And we have seen a lot of these people coming with irregular periods, thereby again affecting their ovulation. So this is about the physical stress what we are talking about. Now coming to other kind of stress, what we tell is mental stress. That means somebody is going through a stressful period. It could be because of the infertility itself. So now comes the question: does infertility cause stress, or stress causes infertility? Actually, there is no particular answer to this. Each contributes to the other, thereby it becomes a vicious cycle because of which the pregnancy might not happen. Now, coming to the first question: does infertility cause stress? Yes, in a society like ours, where just because they have been married for 1 year, the first question being asked is: do you have are you pregnant, or do you have children? So, certainly, yes, infertility is a stressful condition. Along with that, there will be many other factors like the woman might be having irregular periods, or there might be issues with the husband and wife. All these things might lead to a stressful condition. So, infertility per se leads to stress. Along with that, there might be a requirement for a treatment. Coming to the hospital, going through the scans, medications itself can again lead to stress, increasing the chances of not having a pregnancy quickly. Now, the second question is: does stress cause infertility? Yes, that is very true. Stress can cause infertility. So, when we say stress causes infertility, how does it cause infertility? So, it is basically again a change in the production of the hormones. As I said, when it is a physical stress, the kind of hormones being produced or the imbalance created is slightly different than when it is the mental kind of stress, what we are talking about now. So it can be a change in the production of the endorphins. It might be due to a change in the production of the adrenaline and non-adrenaline, thereby affecting again the hypothalamus-pituitary axis, which can lead to either the ovulation not happening, or having a deleterious effect, that is a negative effect on the endometrium. So what is endometrium? Endometrium is the lining of the uterus which is required. A particular thickness and a pattern of the endometrium is required to hold the pregnancy, what is in medical terminology called as implantation. So for this to happen, the hormone secretions should be at the optimal level. So if whenever there is an increase or the decrease in the production of any of these hormones, it can be either the growth hormone, it can be the endorphins, noradrenaline, adrenaline, prolactin, thyroid hormones, estrogen, progesterone, any of these hormones, when there is an imbalance in the production, it can have a negative effect on the ovulation and certainly on the endometrium. So these factors affect the fertility potential of the woman. Now coming to the other stress factors, it can be in the form of ill health. So some people might have a bacterial infection or a viral infection, which can have an effect on the endometrium. So this is basically a medical stress where because of the infection or because of the effect or some other organ, because the uterus per se is a very delicate organ and it is very much responsive to the stress. So because of the ill health also, the woman might have irregular periods or her pregnancy might not happen. Again, the not only the pregnancy happening, it's a continuation of the pregnancy also, which is important. And we have seen that undue physical stress around the time of implantation can prevent the implantation from happening, or it could be that the implanted embryo might not continue well, wherein we see it can be in the form of a biochemical pregnancy. That means the pregnancy has happened, either the urine pregnancy test is positive, or with the test, what we do, blood test to detect pregnancy called the beta HCG test, can be positive, but the pregnancy does not continue. Either the beta HCG levels become lower, that is a failing pregnancy, or the woman might have a threatened abortion or bleeding, and then the pregnancy might not continue. It can be because of physical stress. Yes, mental stress can also cause the same kind of scenario, but we will not be able to gauge the kind of mental stress the woman is going through. So, what do we do to prevent the stress and its effect on the fertility? So, one of the things what can be done is to have a proper physical exercise routine, but at the same time, not exceeding the stamina of the person who is going through the fertility treatment, or rather who is trying for fertility. So whenever a person comes who probably might be obese, yes, these are the people who really want to go and reduce their weight, and their trainer might have told them to increase their physical activity. Or there might be a person who is physically active or who is in a profession which requires them to be very physically active. So around the time of pregnancy, if somebody is in a profession which needs them to be physically very active, we advise them to reduce the kind of physical activity not only around the time of ovulation but from a little before also, so that around the time of ovulation or around the time of the implantation, which usually happens around a week post, approximately 5 to 7 days post ovulation. So we advise them to be a slightly lesser physically active, probably reducing their physical activity by 20 to 30% is also fair enough to improve the hormone production. So that is about the physical activity for people who are extremely physically active. For people who are in the weight reduction spree, where they have to go through some extreme diets, or probably they have to be physically very active, which they are not used to. So they are usually advised to continue that increased physical activity, which will help them to reduce their weight, thereby improving their chances of pregnancy. So at the time when they are in that mode where they are increasing their physical activity, they are advised to probably postpone their plan of pregnancy so that they achieve the target, that is reducing weight or becoming physically more active, and then plan for pregnancy so that they can maintain a particular level of physical activity which does not hamper their chances of pregnancy. Now, coming to the other physical stress, like people who have to probably travel, or there is a lot of physical activity involved in the everyday life also. There are a lot of people who ask this question saying that they have to travel by four-wheeler, or they have to travel by bus to their workplace. They are not the kind of physical activities which will rather hamper your chances of pregnancy or continuation of pregnancy. So there is no need to be worried about that. Now, coming to the mental stress, there are certain ways by which the mental stress can be reduced. One is eating mindfully. Whenever you eat mindfully at the right time in the right amounts, that itself is one of the ways whereby you can reduce. That means the diet which you take also helps in maintaining a better mental status. Then again comes the effect of yoga and pranayama, or effect of yoga and meditation on improving the or rather reducing the stress. So, how does yoga help in improving the fertility potential? Basically, the asanas which we put while we are doing yoga helps to relax, or rather, it is a kind of way where you stretch your muscles, relax the muscles. So, basically, it is physically and mentally distressing, because of which it has a positive effect on the ovulation, that means on the hormones being produced, our estrogen, progesterone, FSH, LH, which helps in getting a better ovulation. Once the ovulation happens, usually the endometrium responds well. That means, along with the follicle coming up, the endometrium, which is the place to hold the pregnancy, improves. So this helps in improving the chances of pregnancy. And also, yoga does help in reducing the weight. Along with that, we advise people to do pranayama or meditation. So when people do meditation or pranayama, the stress levels are reduced because of the kind of impact it has on the senses or the sensory organs. So because of which the stress levels reduces. Along with that, people are advised to have some measures to reduce. There are people who are very anxious. There are people who are quite aggressive. There might be people who develop anxiety or fear in certain situations. They are now trained to try to change the impact, or try to change the kind of response they give to these situations, such that their level of stress comes down. Along with that, there are many things like having a healthy routine. Basically, when a person has a healthy routine, that means you get up in the morning at the right time, try to do Surya Namaskara in the morning, then have a healthy breakfast, have a good physical activity of 30 to 45 minutes, at least 4 to 5 days in a week. Along with that, have a lifestyle which sort of doesn't create a clutter in the life, and sleep at the right time. All these things also helps in improving the or rather reducing the stress levels. Along with that, there are a lot of people who are very stressed about the kind of treatment they have. So sometimes when we have people or patients who have probably a limited knowledge about the treatment and develop undue stress in their mind, coming to the hospital with a probably not enough knowledge about the treatment, with only fear. So proper discussion with the doctor regarding what can be done to reduce the stress, regarding the treatment options, regarding their ability to achieve their pregnancy. So, a proper discussion also helps in relieving the stress. So, when the couple knows that there are certain very good treatment options available to relieve them of their problem, the stress levels automatically reduce. Plus, the faith in the treatment, whether they are going through any particular kind of treatment, whichever the branch of medicine it can be, the faith in the treatment itself reduces the stress. There is also a role of the family members. When we talk about stress and infertility, infertility is not only applicable to the couple, it can affect the whole family. So, whenever we are talking about stress involved in infertility, we usually say there is a role of the family members also in reducing the stress. So, when a couple come with a very supportive family, their stress levels are usually on the lesser side. They have a good family support. They know that whatever treatment they are going through is going to benefit the whole family. So the family support is also going to relieve the stress. Now comes the role of medicines. Are any medicines required to relieve stress? Yes, sometimes if a person is unduly anxious or has some other particular reason because of which the stress is there, probably a combined treatment along with the treating physician for fertility, a reproductive endocrinologist, and a psychiatrist will usually benefit them. And also the alternative therapy, like as I said, yoga, meditation. These are some of the very important measures by which we have seen that the fertility potential is improved, because the stress levels are on the lower side. Also, not discontinuing the treatment because of stress is very important. What is to be stressed here, that discontinuing the treatment itself can lead to lot of stress. Understanding the condition, getting the right treatment at the right time is very important, because it helps in reducing the stress. Along with that, there are many other ways one can relieve the stress, like probably having a good hobby. So there are certain things where we play with the mind body, so that your mind is occupied in a right manner, in a positive way, and your body responds in a positive way. So probably having either a physically active hobby or a hobby which probably makes you a little less stressful is what is required at this time. Probably because there are a lot of things which are happening, or it's not only the infertility, there are many things. You might have to think about monetarily, you might have to think about the medical condition. So there are so many things involved, and having a hobby or probably doing something which pleases you is going to reduce the stress. So along with that, we usually in our hospital we have a counselor who really helps them, who tries to understand where the level of stress is, what is the kind of stress the couple is going, and we try to advise them accordingly. So holistic approach is what is required to relieve the stress in associated with infertility. So it's not that stress leads to infertility. At times, infertility might lead to stress, and we need to make a fine balance between these two and to help couples achieve a pregnancy. Thank you. Any questions? Yeah. So, is stress the reason you can't get pregnant? As I said, it might be one of the most important reasons that pregnancy is not happening, because due to stress, there are many times we see that there is some sexual dysfunction also, which can be one of the reasons for not getting pregnant, or there can be a change, there can be a hormonal imbalance, which can also lead to you not getting pregnant. Certainly, yes, stress is one of the most important reasons. Yes. Can stress and emotional eating affect fertility? Yes, it can be there. There are a lot of times when we have heard about anorexia nervosa and other kind of things where they can have either it can be bulimia also, or somebody might be having they might have the urge to eat more, which can lead to obesity. So because of obesity, there is a change in the hormone production. Leptins are the release of leptins are affected. This can lead to the release of the hormones being affected and thereby affecting ovulation. Certainly, if at all somebody is overeating, yes, it can affect their ability to get pregnant because of the obesity being caused because of overeating. Then there is one more thing called bulimia and anorexia nervosa, where because of the stress, the woman does not eat. And this again leads to deficiency in the hormone production, thereby affecting ovulation. Either overeating or undereating both can affect fertility. Stress per se does not affect the chances of fertilization of the egg, because, as I said, stress mostly affects the ovulation itself. Beyond that, the fertilization, there are many other factors involved in fertilization, like the quality of the oocyte and the quality of the sperm, whether they have already reached the site of fertilization, that is in the fallopian tube. So there are many other factors involved in ovulation. In fertilization. So stress is not the only reason for fertilization arrest. Stress certainly affects the fertility hormones. Stress does have an effect on the hypothalamus-pituitary axis. That means from the brain, where the production of the hormone, there is a signal for the production of the hormones to the end organ, that is the ovary, which produces the hormones. It can get affected. Whether it can be that the gonadotropin releasing hormone might not be produced in the right amount, which thereby affects the release of the follicle stimulating hormone and the luteinizing hormones, which are both required for the growth of the follicle and the ovulation, and it affects the production of the estrogen and progesterone. So when all these hormones are involved, either the ovulation does not happen or the endometrium doesn't build up well. I mean, there is no enough support. It can lead to luteal phase defect, thereby affecting the chances of pregnancy. Thank you.